Hi there, I'm Janelle Marie, and welcome to Body Beautiful. This is the show where we talk with Bay Area professionals about the latest in cosmetic procedures. We have a lot to talk about today, and with us again is our favorite plastic surgeon, Dr. Joseph Mealy. Hi, Dr. J.
Hi.
How you doing?
Good to be here.
Good to be here, absolutely. We're talking about a lot of stuff. We got breast augmentation, mommy makeovers, liposuction, and
blepharoplasty. There you go.
You know, I've said that so many times, but I think I've got it now.
You got it.
But it's always nice when you say it.
Well, I have more practice.
Yeah, that's true. All right, great to have you here today. Before you get started, remember, any advice we give you today, consult your own physician first. All right, let's start with breast augmentation, right?
Okay.
Very popular, am I right?
Yes, it's always one of the most popular.
All right, so what is it and who's a good candidate, doctor?
So breast augmentation is enhancement of the breast by increasing the size using a breast implant.
Okay.
And there's several types of different types of implants and different places to put the implants depending on what we're trying to accomplish and the shape of the breast where we're starting from.
Okay, so a lot of people when they come in, they're just unhappy with the size and shape of their breast. Maybe they have one that's too big, one too small, anything like that?
Yeah, asymmetry is normal.
Okay.
If it's a small asymmetry, we tend to just ignore it because when we
Right.
put an implant in there, it tends to wash it out a little bit. If there's a cup size difference, though, then we should address that. So.
Gotcha. You know what? Let's talk pictures because everybody likes to
Okay.
see the before and afters. We got our first one here. Talk about that. What's going on?
So this is someone who had breast augmentation. You can see the breasts kind of are deflated.
Yes.
So she's not ptotic. That's our word for sagging.
Right.
Because her nipple is still above the fold in the breast.
Okay.
So she's an ideal candidate for augmentation if
Okay.
she wants larger breasts, of course. Because by adding volume, it adds support, raises the nipple up, and gives the appearance of a lift, though technically that's not a lift, it's just augmentation.
So the augmentation's beautiful, by the way. So she's got fullness on the upper part of the breast. So you didn't have to lift those. And
Correct.
that's because the nipple was in the right
Correct.
space. Okay, good.
Yeah,
So
if there's too much skin or the nipple is very low, then we want to reposition it higher. Otherwise, it just ends up
Gotcha.
staying low.
so scarring minimal in that procedure then, right?
Yeah, so for augmentation, if we're using silicone implants, most common scar is in the fold under the breast.
Okay, that's good.
For saline, we can go there or even go through around the areola.
Okay.
It's like a lot of periareolar insertion.
So not bad. And what's the downtime after that?
So downtime is sore. So the first couple
Okay.
days, it's going to feel like there's maybe an elephant sitting on your chest.
Oh, lovely.
And then by the end of the week,
You're
it's
fine.
forgiven and things look better.
You can vacuum again.
But I expect people to be sore with that because we're stretching the main muscle on the chest.
Oh, okay.
And that's really where the discomfort comes from.
All right, picture number 2.
So similar, but this is someone who's always just a little bit smaller. So she wanted some enlargement in size to be a bigger cup size.
Okay.
And at the same time, we're trying to keep a teardrop shape.
Right.
So often the upper part of the breast is a little indented. So by putting the implant, in this case, behind the muscle, it smooths out that upper pole and gives more of a teardrop shape.
And so when somebody comes in, you know to put the implant in front of the muscle or behind the muscle just by
Yeah,
looking at
depending
their
on what
body
we're trying
type?
to do. I would say
Okay.
majority of the time these days we're going behind the muscle.
Okay. Okay. And was the before picture in this one, was one breast larger than the other in that case?
Usually, yeah, I think one's just a little bit bigger, but the implants are the same size.
Oh, implants are the same. That was what I was going to ask. All right. So minimal scarring in that one. We got picture number 3. What's going on here?
So same thing here. We've just got loss of volume. Again, just restoring
Yeah.
volume is exactly what breast augmentation does.
Okay.
So we're just putting volume back in. She already has a good shape. We're just making it
Gotcha.
bigger.
All right, I've got an email question coming
Okay.
out of Oakland, California. This woman is confused. She said there's so many types of implants. She's
Yes.
heard of gummy bears, she's heard of high profile, everything. What can you tell her? How do we
Yeah, and
figure
a
this
lot of
out?
the terms are overlapping too. So essentially there's 2 main types of implants. There's saline-filled breast implants, and then there's silicone gel-filled breast implants. Within the silicone gel-filled breast implants, there are also different types of gel. Some
Okay.
are more runny, some are more thick. Pretty much all the ones we use these days are fairly thick, so they don't run. We don't have the gel migrating. But
Gotcha.
there are different thicknesses that will help keep the shape better. So if you
Okay.
have a shaped implant, it needs to be very stiff to keep its shape.
Yeah.
A round implant, they tend to be softer, but they give a teardrop shape because gravity brings the softer gel to the bottom.
So basically, when somebody comes in, you will know what shape or type of breast implant they're going to need.
Sure. And
So
I think
they don't
the
have to worry
thinner the
about it too
coverage,
much.
the thinner the skin,
Yeah.
the more likely we are to use an implant that's a little firmer so we don't see rippling or wrinkling.
Gotcha. Yeah, the rippling can be bad,
And
huh?
we don't like that.
I know, that's not good. All right, final picture here.
So same thing, breast augmentation, adding volume. And in each of these cases, I'm trying to match the diameter of the breast.
Okay.
Because if the implant is too wide,
Right.
it will start bumping into the arm. If it's too
Oh.
narrow, it'll leave a big gap between the breasts.
Okay.
So we want to make sure the width matches, and then we can adjust the profile to add or decrease the amount of volume.
Now, you can do a lift with the breast aug. Does the lift have a lot more scarring?
Yes, so a lift, in order to do a lift, we're removing skin.
Okay.
So it can be anywhere from a scar that runs around the areola to the full anchor, sort of upside down capital T sort of scars that we get.
And they fade, correct?
They do.
Okay.
They do fade. And the scar underneath the breast tends to be pretty well hidden in most cases. The ones in the front that we really want to minimize so we don't see them.
And a lot of women want to know, can I breastfeed after I get breast augmentation or a lift?
Sure. Yeah, the current recommendation is to go ahead and breastfeed, especially if that's important to you.
That's good.
If it's really, really important, you may want to have children before having breast augmentation because you may make less milk with an implant in place.
Oh, okay. And what about, you hear implants have to be replaced and all that kind of stuff?
Sure.
You know.
No, I see it on the internet all the time. At 10 years, you have to replace your implants.
Yeah, it's scary.
Implants need to be replaced when there's a problem with them. So there's
Okay.
no expiration date. There's nothing that says, oh, 10 years from now, I need to get them changed.
Gotcha.
As long as they're soft, they're in the right place, they're the right size, we tend to leave them alone.
Okay, that's good
The other
to
side
know.
of that coin is about a fourth of women who get breast augmentation have a second surgery within 10 years.
Oh, really?
Mostly to increase the size.
Gotcha.
But also if there's a leak in the implant or the capsule, the pocket that holds the implant gets tight, then we need to do surgery to soften it.
All right, sounds good. All right, that went quickly. Now, if you want more information about Dr. Mealy right here, you can call his office, 925-943-6353, or check him out on the web at either drmealy.com or sanfranciscobreast.com. All the before and after pictures will be right there so you can see everything. We're going to come back with mommy makeovers, always very popular. So we'll be right back. Keep it here on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.